The surgical safety checklist is a series of systematic checks that we are required to perform as part of the surgical process. We perform the checks not only to comply with World Health Organization standards, but also to ensure the safety of our staff and patients, and to protect our professional reputation as a first-class healthcare provider. Therefore, it is the aim of this short video to introduce you to the surgical safety checklist and demonstrate how and when the checks are conducted. In order to place these checks in context, we'll start with the initial ward handover just after the patient has arrived in the anaesthetic suite, and we'll finish with the full handover process that takes place post-surgery. In this scenario, our patient has just arrived in the anaesthetic suite. After they have been made comfortable, the ward handover can then take place. In this handover, a member of the theatre team conducts a series of mandatory checks with the ward nurse to ensure the patient has been fully prepared for the anaesthetic process. They will first check that the patient consent form has been completed by both the patient and the surgeon, and that the operation site has been confirmed with the patient and marked by the surgeon. A point to note is that both of these checks should be confirmed verbally by the patient. Once that's done, they will next confirm that hair is removed from the operation site using a clipper with a disposable head. They will then check that any prosthesis, loose teeth or crowns have been identified and removed if necessary, and that jewellery has been removed or covered as appropriate. They can then check for signs of skin abrasions or existing pressure ulcers. They then record the last times at which the patient ate or drank, and check when the patient last took medication. Finally, they check when the patient last passed urine, that the VTE risk assessment has been completed, and note any particular patient needs, such as hearing or language difficulties. Female patients will also have their pregnancy status confirmed. Once completed, both parties are required to sign and add the time to the checklist. The theatre staff member can now move on to the sign-in check, which must be conducted before the induction of anaesthetic. The sequence of the check is as follows. The person responsible first confirms the patient's identity, which side the procedure is on, and that consent has been given. And as with the ward handover, the patient should be encouraged to respond verbally to these questions. The next stage is to confirm the patient's identity verbally against the operating list, check their wristband, and then confirm consent and patient records. They then check that the surgical site is marked and the block site is confirmed, if applicable. Next, the availability of full AA-GBI monitoring is checked. Then they confirm that the anaesthetic machine and medication checks have also been conducted. The final check of the sign-in phase is to confirm the patient's allergy status. Once the sign-in is complete, we can continue with the anaesthetic process before the patient is moved into theatre.
Good, so can I confirm that all team members are present and we've introduced ourselves?
Absolutely.
The next check is the timeout. This check takes place in theatre before the start of surgical intervention. In this example, it's being conducted by the surgeon. However, in reality, it could be delegated to any qualified person. But if it is delegated, it remains the surgeon's responsibility to ensure that it is conducted correctly and accurately. In the first check, the surgeon confirms that all team members are present and known to one another. They next reconfirm the patient's identity, that the procedure is correct against the operating list, and that consent has been given. If the patient has been given a local anaesthetic, they are required to respond verbally to these questions. And if the patient is female, their pregnancy status is confirmed. The next stage is to confirm whether blood loss greater than 500 mL is anticipated. Confirm that the VTE risk assessment has been conducted and to ensure the correct imaging is being displayed. They can now move on to check if any specific imaging, equipment or investigations are required, and check the availability of prosthesis if applicable. Once this is done, they then ask the team if anyone has any specific concerns so far. The next group of checks are aimed at the anaesthetist, but the team still needs to pay attention nonetheless. First, the anaesthetist confirms their ASA grade for the record, then ensures that all relevant monitoring equipment is turned on, any allergies have been identified, and confirms whether antibiotics have been administered or not. They then confirm that patient warming is turned on and if glycaemic control is necessary. At this point, the team is asked again if there are any specific concerns so far. In the last two checks of the timeout, the scrub practitioner confirms instrument sterility and is given the opportunity to raise any issues or concerns that they have regarding equipment. Once this is completed, the surgeon can then sign the timeout form and record the time. At this point, surgical intervention can start, and the team can proceed, confident that all systems have been checked and they have fulfilled their duty of care to the patient. The third and final check is the sign out. This check is conducted in the operating theatre, and it is important that it happens before any member of the team has left. This check should be conducted by any qualified member of staff, but it remains the surgeon's responsibility to ensure that it is done correctly. The first check of the sign out is to ensure that the procedure was recorded. Then the person responsible confirms that all instrument, sharps and swab counts are complete, and that all instruments have been checked for integrity, that all parts are present and that they are functioning correctly. Next, they ensure that tourniquets have been removed and time has been recorded. Then they confirm that both the surgical and anaesthetic throat packs have also been removed. In the next group of checks, the registered practitioner verbally confirms with the team that they have logged, agreed and labelled all specimens, reported any equipment problems, and then raise any unexpected issues if necessary. The next two checks relate directly to the patient's handover to recovery and include that antibiotic or VTE and glycaemic control is in place, and that the anaesthetist has flushed or removed any IV lines as necessary. When these have been completed, the person making the checks asks the team for a final time if there are any specific concerns. If any are raised, they are recorded as appropriate. This signals the end of the surgical safety check, and the sign-out sheet can now be signed and the time added. Once the patient has been moved into the recovery room, they must be formally handed over to the recovery practitioner by the theatre team. First, the anaesthetist will cover the anaesthetic elements of the handover, specifically the type of anaesthetic used, what drugs have been used and in what quantity, whether the patient has any allergies, what IV fluids are being used, any further pain relief instructions, and any other relevant information. Next, the scrub nurse briefs the recovery practitioner on the surgical elements of the handover. Here, they will confirm the procedure, highlight what sutures and dressings were used, point out any drains or catheters, and raise any other relevant issues. At this point, providing the recovery practitioner has no further questions, the patient has been successfully handed over to the recovery team. When the patient is ready to be transferred to a ward, the final handover in the chain can take place. This takes place between the recovery practitioner and a ward nurse. Here the recovery practitioner confirms with the ward nurse, first of all the procedure, then they point out any drains or catheters that are in use, report on the state of the patient's dressings, confirm that their national early warning score is within acceptable parameters, explain the patient's pain relief as per their prescription chart, And finally, they can raise any further relevant issues. At this stage, the patient is ready to be transferred to a ward. The Surgical Safety Checklist is designed to assist healthcare professionals in the execution of their duties. It is a simple system that represents a holistic approach to patient safety in theatre and should not be ignored or truncated. Important points to remember are as follows. First, that the sign-in check takes place before the induction of anaesthesia. The time-out check happens prior to any surgical intervention, and the sign-out check is conducted before any personnel are allowed to leave theatre. Finally, it is the responsibility of the senior person present to ensure that all checks are completed accurately. We hope you have found this brief video of use. If you have any further questions, please direct them to a senior member of your team.